Welcome to Skin and Health Secrets today's episode. Dryness, itching, and inflammation, especially in children and young adults, commonly labeled as either eczema or atopic dermatitis. Are they both same? What is happening inside the skin? And why are ceramides or moisturizers considered to be a foundation of the treatment? To help us understand the science behind, so we have Dr. Gautami, a consultant dermatologist from Shimoga, Karnataka. Thank you, doctor, for joining us.
Hello, thank you for having me here, sir.
So, doctor, let's begin with a simple question. What is eczema?
So basically, eczema is a broad term. It's not a single condition. In simple words, I can say it's an inflammation of skin.
Right.
They mainly presents with intense itching, dryness, and redness. So eczema is a general category, not a single disease.
Right. Okay. And where does this atopic dermatitis fit in?
Atopic dermatitis is one of the most common types of eczema.
Right.
And in recent times, its cases are increasing exponentially.
Okay.
And the main problem in atopic dermatitis is barrier dysfunction.
Okay, barrier dysfunction. Okay, this like a very important topic. You mentioned a barrier dysfunction. So what exactly does that mean?
To break it down in simple words, the most outer layer of our skin is stratum corneum. Right. And think of it as a protective wall.
Yeah. So what that, sorry to interrupt you. So stratum corneum. So these many people, don't know. So can you, elaborate?
Our skin has divided into three parts:
Right.
epidermis, dermis, and the subcutaneous tissue.
Right.
The epidermis has 4 to 5 layers. Right. And in that, the outermost part is stratum corneum.
Right. Okay.
It's like a protective wall for us.
Right.
So think of it as like protective wall, and the
Right.
skin cells are its bricks, and
Right.
the barrier lipids is its cement.
Right.
And the barrier lipids are ceramide, cholesterol, and free fatty acid.
Right.
And they're present in the ratio 3:1:1. And we dermatologists call it as golden ratio.
So that is triple lipid barriers, what you
Yes,
say.
yes.
Okay, okay. So and what happens when this barrier weakens?
When this barrier dysfunction occurs, this creates a vicious cycle.
Right.
Like when the ceramide reduces, that increases the water loss from the skin.
Right.
That causes dryness.
Okay.
That initiates the itching and scratching. This further damages the barrier, and that creates more inflammation in the skin. So the main key step in this management is breaking this vicious cycle. So the ceramide-based moisturizers and the anti-inflammatory treatment come into action at this stage.
Okay. So moisturizers are not just cosmetics, right?
Absolutely not. These moisturizers are actually first-line treatment in atopic dermatitis. They are far more crucial than corticosteroids in the long-term control of the disease. So we preferably advise barrier repair moisturizers containing this ceramide, cholesterol, free fatty acid in that proper physiological ratio. And this helps in mimicking the natural barrier of our skin.
Okay. See, doctor, many times, we see that, like during winter times, usually people apply lip balm and other kind of moisturizers. I've seen many like either moisturizers or lip balms. So they are not long term, if I apply, so every, like after 10, 15 minutes, I feel that once again I have to reapply. So how about, even many moisturizers, but how about, this long term? Because the short term, I don't know, this is, can you elaborate or explain?
See, earlier as moisturizer, this petroleum jelly, liquid paraffin, whites of paraffin, the coconut oil were used as the moisturizer in this barrier dysfunction condition, which is not much beneficial because these old age moisturizers, they used to be used very frequently and they are not much beneficial in the barrier repair. These new age moisturizers containing the ceramide, squalene, free fatty acid, they mainly focus on tackling this barrier repair situation.
Okay, so that you mean only that occlusive part on the top of the skin only it works. So internally, it will not like, as you say.
Yeah, the old age moisturizer mainly had this emollient, humectant property. The
Okay.
barrier repair property is very, very minimal in those.
Okay.
The new age moisturizers are very good in this tackling situation.
Okay, right. So, is barrier repair, as you said, important only in atopic dermatitis?
No, this is important in all the inflammatory conditions and also this post-aesthetic procedures, what we do. Usually these inflammatory conditions like atopic dermatitis, chronic eczema, ichthyosis, or even psoriasis, and even like aesthetic conditions, aesthetic procedures like Botox or lasers and chemical peel and this new trend, Instagram trend happening that is they use more of skin actives like retinol, azelaic acid, glycolic acid. What they do, they damage the barrier. So for that also, this new age moisturizers like ceramides, they help in the barrier repair. That's what we are focusing right now.
Yes, so that I think, we can discuss, in the future, discussion about the particular content of retinols and all, because many dermats, if we see, so they say that, like without the consultation of the doctors, do not use, right? Maybe moisturizers, no harm. And the hyaluronic acid kind of, product, I think there is no harm.
And I
But,
have to add one more thing.
Yes.
This anti-aging treatment,
right,
the base, the most foundation step is the moisturizer and the sunscreen. So they are non-negotiable. That has to be proper, and for that, the ceramide-based moisturizers are the proper foundation in anti-aging routines.
okay, fine. So what practically, like you advise, you give it to the patients or the parents?
See, as dermatologists, it's our duty to
Right.
spread awareness and point out things which are silently ruining our skin. So let me give you a simple skin routine, which is non-negotiable, has to be done. Like proper bathing practice, proper clothing practice, and proper barrier repair. So coming to bathing practice, avoid hot water, use lukewarm water or cold normal water. And the duration has to be within 5 to 10 minutes. Most of the old age people, we know, once they go, after 1 hour, they come out of the bathroom. So that is very, very, very wrong. And the duration has to be within 5 to 10 minutes. Coming to this, the soap we use, preferably the Syndet bars or the bathing gels has to be preferred because the pH of that is in sync with the pH of our skin. And then coming to the clothing practice.
So what should be the, the pH you prefer or advise?
The pH of skin is in the acidic range.
Okay.
So 5.5, 4.5. But the most of the commercially available soaps, they are in the alkaline range.
Okay.
That is at the 9.5, 8.5. What they do, they slowly strip the barriers. And what we see in old age, they have this crackling, skin crackling. They are mainly due to this bathing practice and the soap they use. So the first advice what we give to the patient is this bathing practice and the proper soap usage and the proper clothing practice. Coming to this clothing practice, preferably we say this cotton and lightweight, breathable fabric has to be used. Coming to the most important point, moisturizers. So as soon as you come out of the after bath, so you have to apply the moisturizer immediately. Like the time duration is within 3 minutes of towel drying your skin. And then you have to apply 3 to 4 times a day. Most of them do the mistake here only. Morning they apply, done for the day. They don't even use anywhere in the day. So that thing people has to change according to me, and the frequency has to be 3 to 4 times a day. And moisturizer should be fragrance free, and for limbs, that is the hand and the leg, thick moisturizers are preferred. The thick moisturizers should not be used for the face.
So you mean like, the fairness cream and all, when they use it. So whenever, they are going out, like morning they are going to office or afternoon they are going out or evening, they apply many times. So you mean that even the moisturizers are, like basically, they have to apply, reapply like many times.
Yes.
So then only, your skin, will be healthy, right? So like the fairness cream earlier, the people for using. So they are missing that breaking that up.
Absolutely right, correct.
Okay, right. So if we summarize this, eczema is a broad term, and atopic dermatitis is a chronic form. The core issue is barrier damage, as you informed. And here, the barrier damage, when happens, the reason is ceramide level is low, right?
Yes. When we repair the barrier, we repair the inflammation and itching and the recurrent flare-ups. So the key step in this longer-term control is the repairing of the barrier. And I would like to add one interesting concept regarding atopic dermatitis, that is hygiene hypothesis. And you may all guess that those who maintain proper hygiene has lowest risk of getting the atopic dermatitis, but it is quite the opposite. So the risk of developing atopic dermatitis is more in the developed countries than in the developing countries. The thing is, the children in these developing countries, from their childhood, they are exposed to these microbes, parasites, and they are present in this unhygienic environment, and they have developed immunity against all of this. So those who grew up with these pet animals, farm animals, they have a lesser risk of developing atopic dermatitis than these urban grew children. So because of the immunity also plays a major step in this barrier improvement. So my main last thing is you have to have a proper barrier control, and this barrier control is not just when the disease comes. It has to be used even when the symptoms are reduced to prevent the next episode. This is my key take-home message.
Okay. So thank you, doctor. So explaining, these science so clearly. To the audience, as a doctor suggested, the reapplication is very important. It is not like, when you have itching or, when you see the skin is damaged, you are applying and you are stopping. So that is, like as you narrated earlier, like, how the finish creams and all be used, and, these moisturizers are, nowadays, in the future also, those applications are, very, very important. Reapplication is very, very important, right? So here, the core thing comes is stay healthy. So then, your skin should be having a healthy barrier, right? You should, keep your healthy barrier.
Thank you so much for giving me this platform to raise awareness regarding atopic dermatitis and barrier repair.
To the listeners, as doctor narrated so clearly, your healthy skin start with the healthy barrier. It's not only your skin and disease get controlled or treated. Even after that, reapplication is so important. So choose your moisturizers wisely, which has a ceramide content moisturizers and which can balances the triple lipid barriers. That is so important. So choose moisturizers wisely and use it. And reapplication is so important. Thank you.